Welcome back, everyone. If you've ever wondered why that one stubborn pocket of fat absolutely refuses to leave no matter how much you diet or exercise, you are in the exact right place. Today, we're setting the stage for a premium clinical deep dive into the truly fascinating cellular mechanics of fat-dissolving treatments. If you love understanding exactly how biological processes can be leveraged for aesthetic optimization, let's break down the hard science of injectable lipolysis, unpacking what literally happens at the microscopic level when these compounds hit the body.
Okay, let's dive into our clinical protocol today. We are going to start with the science of lipolysis, move into injectable mechanisms and target areas, outline patient assessment, detail precision administration, and finally, evaluate the real-world efficacy and risks.
Section 1. The Science of Lipolysis. Defining the biological baseline.
So before we even look at the treatments themselves, we have to lay down the foundational biology of the adipocyte, also known as the fat cell. In strictly medical terms, lipolysis is just the breakdown of fat stored inside these adipocytes into free fatty acids. Simple enough, right? But in the realm of aesthetic medicine, this term means something very specific. We're talking about zeroing in on those highly localized, incredibly resistant fat deposits. It is all about precision contouring for small pockets of fat that just will not budge.
And actually, I want to draw a really stark clinical contrast here because it gets misunderstood all the time. Lipolysis is strictly a contouring procedure. Picture a patient who is already sitting at a lean 10% body fat, but they have this one isolated genetic double chin that refuses to go away. That is exactly where lipolysis shines. It is absolutely not a treatment for obesity, nor is it a swap for systemic weight loss procedures, bariatric surgery, or GLP-1 medications. It's meant to put the final defining touch on the body's contours.
To really grasp why this works, we have to respect the tissue itself. Fat cells aren't just these passive little storage lockers. They are incredibly busy, biologically active organs. Sure, they store energy, provide thermal insulation, and cushion against trauma, but crucially, they are massive players in endocrine signaling. They are hormonally active. They can literally signal your body to produce more estrogen and reduce testosterone. And these active cells naturally grow larger, which is hypertrophy, and multiply in number, hyperplasia. Lipolysis? It basically works as a highly targeted chemical counterattack against these natural biological mechanisms.
Moving right along to Section 2, Injectable Fat-Dissolving Mechanisms, Chemical Agents at the Cellular Level.
All right, let's look at the precise chemistry inside the syringe. First off, it is absolutely non-negotiable that these chemical agents come from a regulated, compounding pharmacy to ensure strict sterility and safety. Inside that syringe, you usually have this fascinating interplay between two main ingredients, phosphatidylcholine, or PPC, and deoxycholic acid. Now, early on, people thought PPC melted the fat all on its own. But modern science actually shows PPC is more of a wingman. It emulsifies lipids, alters cell membrane dynamics, and helps with transport. The real heavy lifter? Deoxycholic acid. And here's the crazy part. It's the exact same natural bile acid your stomach uses to digest your lunch. Only here, it's put to work to literally digest and destroy fat cells.
And this brilliantly illustrates the biological cascade that follows. Step 1. The deocholic acid completely disrupts the cell membrane of the adipocyte. This causes cytolysis. Basically, the cell bursts and dies, dumping its internal lipids right into the surrounding area. Naturally, that triggers an immediate inflammatory response. Then, step 4, your body's macrophages swoop in. Think of them like a microscopic cleanup crew vacuuming up the cellular debris, which eventually leads to localized tissue remodeling. It's not magic, it's a highly controlled, natural clearance of destroyed cells. Now, building on traditional chemistry, there's this fascinating newer approach out of Italy called the Cesarelli method. Instead of just destroying the cell wall directly, this method relies on the Fenton reaction. By injecting a highly specific, precise combo of iron, vitamin C, and a local anesthetic, it generates reactive oxygen species, free radicals, basically. And these free radicals force the adipocyte to kill itself through programmed cell death, known as apoptosis. The cell essentially gracefully turns itself off, and then the dead cells are cleared away. It's a remarkably elegant biological hack, honestly.
Section 3. Identifying Target Treatment Areas. Anatomical Applications.
So, shifting from the theoretical cellular chemistry to real-world anatomy, where do we actually put this stuff? Well, these agents are incredibly effective when applied to very specific pockets. In the face, we're almost always targeting submental fat, the double chin, or the jowls. Down on the body, lean individuals frequently use this to help their abdominal muscles pop a little more, or to trim down the flanks and bra area. And for the extremities,
The inner and outer thighs, lower back, and the back of the upper arms in women are prime targets for getting that crisp contour definition.
But knowing exactly where to inject brings us to a really vital question. Who is the ideal candidate for lipolysis? Because, spoiler alert, not everyone who wants this treatment should actually get it.
Which brings us to Section 4, Patient Assessment and Contraindications, the clinical evaluation.
Listen, the clinical evaluation is arguably the absolute most critical step of this entire process. Like we established, this isn't a miracle drug. You are never going to proceed if there's an active infection or if the patient is pregnant or breastfeeding. And again, if severe obesity is the primary issue, this is totally the wrong pathway. Same goes for anyone with a history of keloids or severe scarring. But, and pay really close attention to this one, poor skin elasticity is a massive deal breaker. If you chemically dissolve fat underneath skin that doesn't have the elastic snap to shrink and mold back into place, you are not going to get a visual improvement. You might even make it look worse. Managing these clinical expectations is absolutely paramount.
Section 5, Precision Administration and Anatomy, Executing the Intervention.
Okay, so once a patient passes the evaluation, the execution has to be flawless. The crucial point here is how this intervention is physically executed. You have to methodically map out the treatment area with a grid, no guessing. This ensures precision and prevents you from accidentally overlapping doses. After full sterile clinical preparation, the placement must be strictly subcutaneous. The practitioner has to meticulously avoid injecting into the dermis above or the muscle below. Maintaining that safe injection depth is absolutely mandatory, which means you really have to accurately assess the initial fat thickness before picking up the syringe.
And to pull off that level of extreme precision, especially in delicate facial areas, practitioners use insulin syringes with an exact needle gauge of 30 to 32. To put that into perspective, that is roughly the thickness of a single human hair. Now, for the body, they might bump up to a 27 or 30 gauge, but using needles this incredibly fine really underscores just how much meticulous clinical precision is required for the procedure.
And the reason you need that microscopic precision is the underlying anatomy. It is no joke. When you treat the submental area, you are navigating a literal minefield of critical structures. You've got the platysma muscle, submandibular glands, facial arteries, veins, and the marginal mandibular nerve, all right there. I want to sternly warn you, incorrect depth or placement in this zone can cause severe complications. We're talking facial asymmetry, dysphagia, which is difficulty swallowing, tissue necrosis, or neuropraxia, which is nerve injury. For instance, injecting anywhere near cranial nerve 7 is a massive risk, which is exactly why the buccal fat area is often just completely avoided.
Now, if the procedure is executed flawlessly, you have to remember, this is a marathon, not a sprint. Patients usually need between 2 to 6 sessions, and crucially, these sessions have to be spaced exactly 4 to 8 weeks apart. You literally have to give the body's physiology enough time to complete the cellular breakdown, do the cleanup, and finish the tissue remodeling cascade before you even think about introducing more chemical agents.
Finally, Section 6, Efficacy, Outcomes, and Risks, Managing Clinical Realities.
Let's transparently walk through the real-world data and the adverse effects profile, because keeping it real and medically honest is what we do here. Since this relies on an inflammatory response, you should 100% expect swelling, bruising, tenderness, and maybe some temporary numbness. That's just part of the process. The results? They're modest, gradual, and highly operator-dependent. Less commonly, things like fibrosis, hyperpigmentation, or seromas can pop up. And while it's rare, the serious complications, things like skin necrosis, nerve injury, vascular compromise, and infection, those highlight exactly why this isn't just a casual spa trip. It is a serious medical intervention that must be performed by highly skilled professionals. So, we've broken down the cellular cascade, the absolute precision required, and the stark realities of lipolysis. But as we look toward the horizon of aesthetic medicine, this field is just accelerating. I want to leave you with this final thought to chew on. As methods like the Fenton reaction continue to evolve, how will targeted cellular apoptosis redefine the future boundaries of longevity and aesthetic medicine? It is such a fascinating intersection of cellular biology and human optimization. Thank you so much for joining me in this explainer today. Keep learning, keep optimizing, and I'll catch you in the next one.